can we use Molly to treat psychopathy? So as a drug scientist, I find Molly to be one of the most genuinely fascinating drugs out there. And that's because it has like a whole bunch of different properties with it. So first, it is kind of a hallucinogen and kind of also a stimulant, but not really fully either. So it's not producing any sort of like the wild hallucinations that people typically have, but it's also not increasing dopamine to the same amount that the other stimulants do. So it's working on like serotonin and dopamine and norepinephrine, all of those combined. And also, it is an entheogen, which is a genuinely fascinating thing. So what it does is it seems to actually increase things like empathy and pro-social behavior. And so some of its abilities, like its ability to process negative emotions, actually relate to why it's being used for things like treating PTSD. So inevitably, when I talk about this in my neuroscience class, somebody's like, okay, but then can you actually use Molly or MDMA to treat psychopathy? So to understand this, you have to understand first a couple of like specific terms here. So people have a tendency to use the word psychopathy and sociopathy, and antisocial personality disorder is like the same thing. They are actually decently different from one another. So psychopathy is a set of personality traits. They are typically measured with like Hare's checklist, and they're typically things like superficial charm, like a lack of remorse, and a lack of empathy. Then you have antisocial personality disorder, which is an actual personality disorder. So it is in the Diagnostic and Statistical Manual of Disorders, the DSM-5-TR. An antisocial personality disorder has things like lying, a lack of remorse, basically feeling grandiose, and also includes a lack of empathy, which includes impairments in social functioning. But I'm not a clinician, so I'm not going to go into some of the more nuanced ideas here. But if you are, feel free to tell others what they should know about this. So basically, the different words kind of get thrown around a lot, but lack of empathy is kind of an aspect that is incorporated in all of them. So then back to the original question. Could you actually then use Molly to treat the lack of empathy that you see in people who have been diagnosed with antisocial personality disorder or fit the psychopathy checklist according to Hare? Theoretically, yes, but let me explain all of the potential problems associated with this. The first problem, there are different types of empathy. So we have things like cognitive empathy and emotional empathy. And cognitive empathy is more of like that perspective taking side of things. Can you understand what that other person is thinking? Whereas emotional empathy is actually, can you feel what that other person is feeling? So like psychopathy seems to be more closely linked to cognitive empathy, although that seems to be up for debate. Whereas Molly seems to work more on that emotional empathy side. So maybe Molly could work, but just on the wrong type of empathy. If there is a wrong type of empathy. Like there's a chance that it could be helpful, but we just don't know enough to actually even be able to fully hypothesize that. And then there's this other problem, and that is that psychopathy is incredibly difficult to study. So first, it's just genuinely difficult to find people who fit those traits. And this seems to be linked to the idea that there is such a stigma against psychopathy. So scientists will actually go to places like temp agencies to find people with psychopathic traits. And that is because that type of position is common for people who have problems with things like long-term relationships, have problems with being able to empathize with other people. So they might be more likely to not be able to hold down a steady job because they're having difficult relationships with coworkers. Maybe they have problems with their boss. Maybe they've caught them lying all the time. And so they can't hold down that job. And so temp agencies are good because they only have to be there for short periods of time. And their behaviors can actually be beneficial in those settings. Like charm in a salesman that you're only going to meet once, that could be a good job for them. And the other place that scientists commonly find people with psychopathic traits is in prison, because they have a tendency, again, to lie, and antisocial personality disorder in particular is actually linked to crime. So in that case, the group of people with these traits that you have is probably not a good selection. So you're not actually looking at everyone who has these tendencies. You're only looking at people who have these tendencies who have then committed crimes and been caught. This is what we commonly think people with psychopathy are. Like when we think of like people who are sociopaths or psychopaths, we use those words in like a scary way. But like if we're thinking about things like empathy as being on some sort of like continuum, like you have the spectrum of symptoms, like there are going to be people who have a considered normal level of empathy, and then there are going to be people on either end of the spectrum. So some who have too high empathy, you've probably met somebody like that, and some who have too low of empathy, and we just label them as something incredibly stigmatizing. Like, when's the last time you actually thought about the stigma against psychopathy? We just kind of demonize it without even thinking about it. Like, sometimes these traits might actually be beneficial for people in certain jobs, so they might actually be promoted. So something like being a ruthless business person is typically thought of as a good thing in that world. So could we hypothetically test to see if Molly helps people with psychopathic traits? Yes, you could. But first you have to find those people, which is problematic in and of itself. And then after that, you have to convince an ethics board to actually allow you to give those people Molly for science reasons. And like literally one of the main categories for ruling people out from doing this type of research is if they have a personality disorder. So you have to have the ethics board allow that. And then if you are finding the people who are psychopaths using kind of the criminal method that a lot of people do, so looking at people who are convicted, you are going to have an extra hard time because they are considered a vulnerable population. Like there is this tendency for people to automatically think that no matter what they do, even if you tell them that this will not help them get out of jail or prison, that they will think that it will no matter what. And so there's this kind of like idea of coercion no matter what in these research studies. And then, like, do you only allow people who've used this drug before? Because if not, then you're giving somebody a brand new drug for the first time, and that could be linked to things like addiction risk. So like people have tested other types of psychedelics for other personality disorders. Like they have done an ayahuasca ceremony and found that that actually might reduce things like narcissism. And then there's apparently research conducted in Switzerland from 1988 to 1993, where they said that they definitely for sure tested Molly and acid on people with narcissistic personality disorder. Nothing bad happened, we promise. Like that was the one mention that you saw in a scientific article about that. And other groups have suggested that it might be good for things like borderline personality disorder. So this original group has looked to see how things like oxytocin influence empathy. What they saw is that criminal violent offenders who had psychopathic tendencies, when they saw like these faces morph becoming more and more frightened looking, like the brains of the people who did not have empathy, so who had the psychopathic tendencies, they did not activate in the same way. But when they gave them oxytocin, which can influence pro-social behavior, that actually made them kind of light up the same way that the control group did, so the people without psychopathic tendencies. And we know that Molly influences oxytocin too, so there might be something here. So I'm going to keep an eye on this and see if anything comes out of this. This was just recently studied. But hypothetically, yes, this could be a valid thing. But then also think about the ethics of this. And is this a thing we should be doing, not just a thing that we can actually do?